Hello, my name is Beckerman and I'm a congenital heart surgeon at Duke Health. Congenital heart disease describes a situation when either the heart or great vessels do not develop in normal fashion during fetal life. Surprisingly, it is more common than most think. 1 out of every 100 babies is born with a congenital heart defect, and 25% of these will have a defect which is severe enough to require an intervention during the first year of life. The most common heart defects are heart valve defects, septal defects, or holes in the heart as we call them, and defects in the large blood vessels. I care for all patients with congenital heart disease from newborn life to adulthood. Two of my main areas of focus and interest are complex congenital heart disease in adults and genetic diseases involving the aorta and the aortic valve. Over the past 2 decades, there's been dramatic changes in the field of congenital heart disease. The majority of children with congenital heart disease are now living way into adulthood. We estimate that there are over 2 million adult individuals in the United States living with congenital heart disease. These patients are referred to as adult congenital patients. Due to their complex medical history and previous interventions, they require dedicated, comprehensive care for optimizing their long-term outcomes. Same goes for patients born with cardiovascular genetic disorders, especially those involving the aorta and the aortic valve. Some of these syndromes are Marfan syndrome, Lewis-Dietz syndrome, Turner's, and others. Understanding the underlying genetic causes, early diagnosis, timely surveillance, prophylactic repair, and family screening are keys to addressing these diseases. Congenital heart disease is in many times a disabling diagnosis not only for the patient, but for their entire family. As such, I believe that care for congenital heart patients should provide comprehensive support for the patient and the family. Our approach is to work together with the patient and the family from day one, or preferably from fetal life, supporting them, setting the expectations, and providing a long-term plan and support in a collaborative, transparent approach. I chose to become a congenital heart surgeon because I felt that this would give me the opportunity to discover the cause of a variety of complex, disabling, or life-threatening problems, fix them, and enable the patient to carry on with their life. Duke Health and Duke Children's is the best congenital heart program in North Carolina and one of the best in the world. What signifies our program is not only the ability to provide every possible care that patients with congenital heart disease may need, but also continuously change and challenge the field and develop unique, innovative, new approaches and solutions for medical problems. There are numerous amazing parts in congenital heart surgery. Each and every one of them is magical. Performing a successful operation, talking to the family afterwards, caring for the patient during the recovery period, and observing the daily clinical improvement. But perhaps the most gratifying is meeting with the families in clinic a few weeks after surgery and observing the significant change and improvement. I feel blessed to be able to enjoy these moments and welcome you all to come and work with us. Thank you.